Well, hello everyone. I'm Dr. David and I'm here with Tanya Grimes in Dr. Block's clinic called the Integrations Medical Center. And Tanya is over the pain center. She's a registered nurse and with a focus and specialty in pain medication, correct?
Yes, that's correct. I do the Medtronic pain pumps. I refill those and manage those.
And I understand you've worked for a while without the pain pumps, with just prescription medication and injections. Tell us about that and how this is so much better than what you've been doing before.
The pain pumps actually kind of give the patients back their life, as in if you take the oral medications, you have a lot of side effects, a lot of somnolence, and with the pain pump, it delivers medication right into the intrathecal space or around the spinal cord, so it works off the nerves and things off the back. So therefore, and it takes a lot less medication.
A lot less?
A lot less, So therefore, only about 10% or less of that medication circulates in the blood, so therefore your side effects are very much less.
And what are the usual side effects we see with people who are on the pills or on injections?
The somnolence, the inability to concentrate, sometimes nausea from having to take the oral medications. Constipation is a big issue.
And of course, there's the addiction factor, where they become totally addicted to it. They become more tolerant of higher and higher doses. Do we see that with this pain pumps?
Oh, no, not at all. There's hardly any way to abuse that. Of course, there's the rare circumstance that they could, but it's something that we control. They don't have access to the medication. It's put in, the pump delivers it at its designated rate. And there's no way they can abuse it, actually.
Fantastic. And so, and then of course there's the convenience factor. Patients come in once in 2 months, 3 months to have their pumps refilled, or what do you do?
Yes, we refill them. It just varies on their dose and their concentration of medication. Sometimes we fill them every couple of weeks in most severe cases. Usually most medications have like a 90-day life in the pump, so it's usually about 3 months.
What are the commonest medications you work with?
Fentanyl, morphine, hydromorphone, which is still allotted, and then we have some of the others like clonidine that we use, baclofen, to back that up. And there's another one that is Prialt, that's the snail venom that works real well for nerve pain.
Interesting. And the commonest cases you see here? I know we looked at a patient with diverticulitis and celiac disease. What are the common diagnoses that you deal with that have pain?
A lot of failed back syndrome.
What's that?
Where they've had repeated back surgeries and supposedly to relieve the pain or whatever, and they ended up with worse pain than when they started. So we see quite a bit of that, actually. A lot of, some of the osteoarthritises. Some of the not quite so common is even the fibromyalgia, discomfort. We see a variety of issues, really.
Fantastic.
Trauma of one sort or another.
And these are people who have tried pretty much everything else.
Yes,
wow.
Absolutely.
And like you said, they have their lives back.
Yes, some of them, or a good percentage of them, if they are not in retirement age, have been able to return back to work and carry on and get their life back because they're no longer half asleep.
Fantastic. Fantastic. So one last word. What would you say to people who are dealing with these chronic pain issues and who are looking for help?
I would say by all means be evaluated for a pain pump, and if that's something that would work, then that would be fantastic.
Okay. Well, thank you so much, Tanya.
You're so welcome. Thank you.